What is up, YouTube? It's your girl, Nicole Taylor. When you see this video and you guys see like have the same hairstyle, same makeup, same outfit, just know that I filmed them back to back in the same day, and don't try to play me. Period. Don't try to play me. Period. Alright, so this video, I'm just gonna be talking about piercings. Cause like when I post on Snapchat, every time I got new piercings, somebody always asks me like, oh, I'm gonna get that, like, you know, did it hurt? Like, how long is it to heal? Just regular questions. And I'm looking at my laptop because, I'm looking at my laptop because I wrote notes, because I got a few piercings, so I wrote notes about each one, so like I would be more organized and I wouldn't be like confused, and I just remember what I need to say about each piercing. So I'm just looking for that document right now. Like, let's get into the video. Alright, no, seriously though. Alright, so the first piercing I'm gonna be talking about, I'm probably gonna put in the description box like all the piercings. If you just don't know about certain piercings, I'm gonna put it and put like what time I started talking about it. So the first one I'm gonna talk about is like the first piercing I remember getting, which is the industrial bar piercing. I got it in my right ear. Like, I don't have it, I don't wear earrings in it because most of the time I wear my hair down. But like for prom, I have my hair in ponytails, so like I had it in. But it's still open. I got that done in 2012, 7th grade. We was at the mall. Me and my sister and my mother went to the mall, Kings Plaza. If you're from Brooklyn, you already know. They got the little piercing booths there, so we went. And they pierced it with the gun. Like, they did it, yeah, like 2 different piercings. So they did one here and one here. They pierced it with the gun. And then we just put the bar in after. So, like, okay, pain scale 1 to 10, I would say it was like a 7, 8. Like, I don't know. I was younger. It was like my first piercing. And like up here is like the it's really thick and hard. So it kind of hurt when they did the gun. Like, I know people say like when you get piercings you're not really supposed to get the gun, but I just feel like it's quicker than the needle. And yeah, I didn't really know much about piercings back then, so I got it. We got it done in the winter time. That was a horrible idea. Like, seriously, having that metal in your ear in this winter, is cold, the wind is blowing, and it's new. It was so painful. Like, it hurt for so long trying to clean it. Like surprisingly, that was one of my most painful piercings for me. Like, it was so painful. And like, I don't even wear earrings in it. Like, I didn't even think about that because I wear my hair down, so I'm like, what's the point? And then when I was wearing my hair down, like, it would be getting caught on there. It was just bad. Like, it was bad. Like, I never, like, it didn't get infected or anything, but it was bad. And I feel like, I don't even know why I did that, because I don't wear my hair up, so who's gonna see it? Like, but yeah, it was like an 8 on the pain scale, 1 to 10. It took quite some time to heal, but that could be because it kept getting caught and things like that. But I would say it took like 6 months, like something like that, to heal. So that's that piercing. The next piercing I remember getting is this nose piercing. Can you guys see? Like, it's this nose piercing. Like, there's 2, but it's the one on the bottom. So I got this piercing. Damn. I think I got it for like, I remember when I got it, but I don't know what year. This was after 9th grade, so it was probably from I was turning 14. Was I? No, it was 14, 9th grade.
No, I definitely was turning 14. This was the summer after 8th grade.
Yeah, this was the summer after 8th grade. And yeah, I was like begging my mother, like we were leaving the dentist, and like, if you live in Brooklyn, you know, J Street, Fulton Street down there, it's a bunch of just stores down there. It's like a little shopping area. So we were leaving, and I just kept begging her. And she finally said yes. So we went into this jewelry shop. Don't do it, guys. Go to a piercing place, a tattoo parlor. Don't go to the little side jewelry shop. Just don't do it. Just don't do it. I'm telling y'all, don't do it. So we went, and like, he pierced it, and he used the gun. Yo, like, if you know, like I know now, when you get nose piercings or any piercing, you're not supposed to, especially if it's not an ear piercing, you're not supposed to get the gun. Because the needle just goes, pierces it, but the gun, literally it pierces it with the earring. Like, it just shoves the earring through your skin. So it went in. I have no problems when I did it, because sometimes with the gun, it doesn't go all the way through. Like, it gets messed up. I didn't have that problem. I would say 1 to 10, it was like a 5. Like, it didn't really hurt bad, but since it's your nose, like, my eyes started tearing. But like, it puts an earring in your nose, so like, it was really big, and it was just ugly. Like, I don't like when I see people with nose piercings, they have a big earring in it. Like, it just looks dumb to me. So because when they do the gun, it puts a back piece on it, and it puts it on really tight. Like, the jewelry started like sinking into my skin. Like, that's how tight it was. So I had to loosen up the back piece, which hurt a lot. And then I ended up, when we went, me and my family went to Queens Center Mall, because we were shopping for back to school. And ended up going to like this little booth that they do piercing and stuff. And I had her change it from that ring to a regular nose ring, like with no back piece. And it was perfectly fine after that. Like, it never got infected or anything, but like, the jewelry was really sinking into my skin, and I had to change it really quickly. I changed it after 2 weeks. You're not really supposed to change it that fast, but I didn't really have a choice. I would say it didn't take long to heal at all. Probably like 6 weeks, 4 weeks. Like, it didn't take long. I just, all my piercings, I wash it. Like, I just make like sea salt and warm water, and I just use that. I don't be buying the Bactine or whatever spray that you could use. Like, you're not supposed to use alcohol or anything like that, because it could dry out the piercing. So yeah, I just did that and like twisted it. And the second nose piercing I got the needle. This is the time I got the needle, and this is the place I go to get all my piercings now. I got the needle, and like, my nose, I don't know if this happens to anyone, but my nose was bleeding for like 5 minutes. And I had got it one time, and it closed because I had to take it out because of my job. Shake Shack. And then I got it done again, and it bled again for like 5 minutes. Like, I don't know, like, if they was hitting something wrong, but like, it just was bleeding. It don't hurt no more. Like, I could move it. It don't hurt. The first time I got it done, it ended up getting infected, like having to take it, like trying to put a band-aid over it for work, and like, just like, it was just crazy. It got infected. Like, I had a bump. And I would say, if you get any piercing and get infected and get a bump, you could use like sea salt rinse to get it down. But what got it down for me in 2 days, literally, I took some Excedrin and I like crushed it up, and I added water to it and made it like a thick paste, and I'll put it on my nose, and I'll just sleep with it, or like just sit around the house with it. And it literally went down in 2 days, and I was so happy, because like, it was so ugly. It's not like my ears or something. Like, it's right on my face, so I was really happy with that. And what else? With any nose piercing, I would say, like, when you first get it done, just pray that you do not get sick. Like, I got sick like right after I got this done, and like, trying to blow your nose, and like, it's a struggle, especially since I have 3 nose piercings, and it's such a small area. Like, trying to blow your nose is a struggle sometimes. Like, I have the C-back piercing, so sometimes they get caught on my septum piercing, or they all get tangled in with each other. Then you're trying to change it, and people looking at you like you picking your nose, when like, no, you just fixing your piercing. But yeah, both of those took like 6 weeks to heal, 4 weeks to heal. It wasn't bad. Pain scale for the gun, I would say, was like a 5. For the needle, probably like a 6. Yeah, like a 6. It wasn't that bad, but like, it was annoying, because like, I was like, literally the blood was like coming down my lip, down my chin. Like, I don't even know. If that happened to you, comment, or like, if you know why that happens, comment and let me know, because I really don't know. So my septum piercing, I got it, I remember, sophomore year. Sophomore year? It's been 2 years.
So, it's supposed to be 17. Why has it been a year? I got it my junior year. I got it my junior year. It was
beginning of junior year. It was it? Yes, it was the beginning of junior year. Was it? It definitely was the beginning of junior year. It was in October 1st. Like, I remember that day. And, like, again, I had to beg my mother. So we went, and when I got this one, like, I was so scared. Like, I thought it was going to hurt so bad. I had to sign the paper, because if you're not over 18, she makes you sign the paper. So I had to sign it, and I was like, I was literally shaking. I was so scared. So, like, I sat down. She made me put my head back. She, like, put the clamp, and she did the needle. And it was, I was saying before, so if the lighting changed or, like, the angle, my bad, but, like, my alarm clock just went off and interrupted my whole video. But, as I was saying, like, she put the needle through. Okay, it's too bright.
It made me feel like I had to sneeze. Like,
Pain scale, I would say it was, like, a 4. Like, it really did hurt. But it made me feel like I had to sneeze. I would say when it was healing, it hurt. Like, trying to move it, like, really, really hurt. Moving it hurt, and it made me sneeze a lot. And like I said, I ended up getting sick. I'm always getting sick. I ended up getting sick. So, like, trying to blow your nose with a new septum piercing is just, like, no. So, I had this one. Then, after a few months, I changed it to a clicker because I wanted the ones that hang this way. I really like those ones. But I had the clicker, and that particular one I had was just hurting. Like, it hurt so bad. So, I had to take it out. But I did end up getting another clicker for my prom, and that one didn't give me no problems. Like, I like those ones better, but I do wear this one, the ones that go this way, like the bowl ones, because, like, at work, I had to flip it up, and I wasn't going to get a clicker and deal with taking it in and out. So, I just flip this one up and flip it down. So, I would say, like, if you work somewhere and you just got it done, you're not allowed to have it, leave it flipped up. Because if you're flipping it up and down, like, it's going to take longer to heal. So just leave it flipped up until it's, like, healed, almost healed. And then you could, like, flip it back down and up, depending on wherever you're going. So, yeah, depending on wherever you're going. But, yeah, don't keep flipping it up and down when you just got it. Because it's going to delay the healing process. Okay. But, like, I don't know if this is, like, TMI, or people probably going to act like it don't happen. Like, what they don't tell you, like, septum piercings, other piercings, I guess it's common sense because it is in your nose. But, like, if you're sick, if you're constantly flipping your piercing up for a long amount of time, like, it be having, like, boogers on it. Like, that's why, like, these piercings I clean the most. Like, most of the time when people piercings are healed, they don't keep up with the cleaning it. I feel like your nose piercings, you have to. Like, it's in your nose. Like, it has boogers and all that stuff. So, like, you have to keep cleaning it. I mean, if you want to walk around like that, I don't know. Like, some people are just different. But, yeah, you just have to keep cleaning it. But, yeah, the septum piercing, like, the healing process was long, kind of. Really, no, it was long and painful. Everyone's different, but it was painful for me. So, yeah. My next piercing, okay, I had the smiley piercing. If you don't know what the smiley piercing is, it's just like that flap under your lip. So, like, when you smile or laugh, you can see it. And I had to take it out. I'm so sad. Like, I'm probably going to get it again. But it didn't hurt at all. That one, like, she just made me, like, hold up my lip. And she put the needle through, put the piercing in. And it was so fast. I guess because that part is so thin, like, it didn't hurt at all. It didn't hurt after neither. But, it started, like, I got it done over a month ago. Almost 2 months. Yeah, almost 2 months ago. And I ended up taking it out, like, last week or the beginning of this week. Because it was hurting, like, I don't know. Maybe I should have just changed the jewelry, but, like, it was, like, pressing against my gums a lot. And, like, it was, like, it would leave, like, a dent. Like, I could see the indentation, like, the shape of the jewelry on my gums. And, like, on this side, like, the left side of the piercing, it was just hurting. Like, hurt when I moved it. Like, it hurt when I was eating, chewing, or if I was laughing too hard. It was just hurting. And the smiley piercing, like, if you're going to get it, you should know that, like, it can cause gum recession. And that's, like, causes, like, your gum to, like, move further away from your teeth. When you go to the dentist, you're going to have to take it out to do cleanings, x-rays. Like, it's just a lot. And even, like, do your research before you get any piercing. Do your research, because every piercing is not for everybody. And it's not, like, even on, like, the person, if they're reputable, like, professional, the person piercing you will tell you, you can look it up, Google will tell you, it's not a piercing that is like a nose piercing, a belly piercing that you can have for years. Like, they will tell you, like, it's a temporary piercing because it could cause, like, gum and teeth problems, because, like, it's constantly laying on your gums, rubbing against your teeth. So they will tell you, like, it's only meant to be worn for a few months, and then you have to take it out. So I wore mine for 2 months. God, I'm still sick. My bad. I wore mine for 2 months, and then I ended up taking it out. But I'm probably gonna get it again because I really, really liked it. Like, it was one of my favorite piercings. Like, I really liked it. So I'm probably just gonna keep doing that. Like, getting it, taking it out, getting it, taking it out. Probably. I still have the jewelry though, and I tried to put it back in like the next day, and it was closed. So I have to get it pierced again. So I have my nipples pierced too. The same day I got my second nose piercing done over, the second day I got my nose piercing done over, I also got my nipples pierced. And I doubt that you can see it. Like, I don't. So yeah, like, I have the pierce. You could kind of see it. Like, no. Is this inappropriate? But yeah, whatever. Yeah, you could kind of see it or whatever. But I got my nipples pierced the same day I got this, and on the 5th, it will make a month. Let me tell y'all about. Let me tell y'all about this. So my nipples, like, this might be inappropriate to your mind, but I don't care. My nipples are always rock hard, like cold, hot, whatever. They're always hard for no reason. So when she went to pierce them, like, she did the left one first. So she had the clamp, she's holding it, and she pierced it from the side. So she puts the needle in and starts pushing it through, and the needle broke. Like, it broke, like, halfway through, it broke. So she had to pull it out and redo it. Like, but it didn't hurt as, like, I see videos of people getting their nipples pierced, they're, like, screaming at the top of their lungs, crying. I don't have that high of a tolerance for pain, and it did not hurt. And my needle broke, and I had to get it done again. And it didn't hurt, like, that bad. Like, 1 to 10, it was, like, a 6. Like, it really wasn't that bad. She did that one, and it kind of hurt when she was, like, screwing the balls in, because, like, it's sore. You just got it pierced, and you're, like, screwing the ball on. And she did the other one. I didn't have any problems when she did the right nipple. I did wear a bra when I wore a regular padded bra. When I went home, it was kind of sore on the way home. Like, she did put, like, a gauze and tape, you know, just to protect it. And it was kind of sore on the way home. When I got home, like, I left that there. I took it off that night before I got in the shower, before I went to bed. So, like, you can just clean it with soap and water in the shower, honestly. I did that, and I also did, like, the sea salt soak. So you just put, like, a little shot glass with sea salt and warm water, and you just, like, flip it. Like, if you're laying there, you can just flip it on your nipple. Leave it there for about 3 to 5 minutes, or you could just, like, use a Q-tip, a cotton pad or whatever, and use that. But mainly, I just let it clean in the shower with soap and water, because that works perfectly fine. So when you're, like, this is why it's important to go to a professional, reputable piercer. When you get your nipples piercings done, the bar is going to be longer. It's not going to fit perfectly like the bars like you would get if it was healed. Because, like, some people, you know, it might swell up and it needs room to swell. So let's common sense. If the bar fits perfectly and it starts swelling, the jewelry is gonna start swelling around the jewelry. The jewelry is gonna start, like how I said, the jewelry was sinking into my skin or my nose. It's gonna do the same thing, and it probably gonna get infected. You're gonna have to take it out. So just make sure they're using a bar that's longer. Mine didn't really swell like that much, but make sure they're using a bar that's longer so it has room to swell if it does. I don't sleep in a bra, but I wore like a tank top to sleep. Like, you know them spaghetti straps that have like the little built-in bra? But if you have a sports bra, you can wear that too. I wore that just because like I didn't want to just like leave the piercing out or whatever. I didn't want, like, I just wasn't sure. So I just wore that and that worked perfectly fine for me. I did that for like a week and a half. But like people say like they take forever to heal. People say that they take like forever to heal, but it really didn't for me. Like, it wasn't hurting or anything. So after like a week and a half, a few days, I took the shirt off and I just went like regular. But then I noticed like the left one was like, I don't know, they never got affected. Like, they're not, but like I feel like the left one was getting sore and stuff. So I started sleeping with the shirt again. I do sleep with the shirt again. So yeah, I feel like before you get any piercing, you should do your research. Like I said, not every piercing is going to be for everyone. Like, you should do your research. Don't get a piercing if you're not gonna keep up with it. So yeah, I think those are all the ones I have: the bars, nose, septum, smiley, nipples. Yeah, that's all I have. And I'm gonna get my smiley piercing back, trust me. Like, people be asking me like, oh, you pierce everything, why don't you get a belly piercing? Like, I just don't want one. Like I said, not every piercing is for everyone, and that is not for me. I just don't want one. But yeah, that's basically it for this video. If you have any questions, or like if I didn't address something or say something, comment below, let me know, hit me up, whatever. Follow me on Instagram. I'm gonna put my Instagram name right here. Like, it's gonna be like right here at the bottom. So follow me, because if you're not following me, what are you doing? If you're gonna watch this video, let me say this: if you're gonna watch these videos, subscribe. Because I have like almost 90 subscribers and I be having like 180 views on a video, and it just doesn't make sense to me. Like, if you're gonna watch it, like, at least press the subscribe button. Like, is it gonna kill you? Hit that bell so you can get notified. Well, I'm like pointing, I don't know where the bell. It's gonna be like somewhere down there. Hit the bell so you get notified whenever I post, so you can do not missing out on nothing. And yeah, that's it for this video. See you guys in my next video.